Moving on to the next presenter of the day, Dr. Shashi Rekha completed her master's in conservative and endodontics. She is a member of editorial review board of Journal of Conservative Dentistry and Journal of Clinical and Diagnostic Research. Executive Committee member, Indian Association of Conservative Dentistry and Endodontics. Life member of International Association of Dental Research, Indian Endodontic Society, Indian Association of Conservative Dentistry and Endodontics, IDA, and Women Dental Association. Currently, Dr. Shashi Rekha is serving as a professor and head, postgraduate clinic, Institute of Dental Sciences, Bhubaneswar, Odisha. Over to you, ma'am.
Thank you.
A very warm welcome to you.
Thank you very much. Now I will share my screen. Is it seen?
Yes, ma'am. Your screen is visible.
Okay, thank you. Good evening, ladies and gentlemen, and my dear friends. This is Mukteshwar Temple in Bhubaneswar. See this wonderful architecture. Why I have just placed this picture is we are all dentists are called as artisans in various their own specialty. So let's seek a blessing from Lord Jagannath. He has a unique, this world famous temple has an unique quality in it. The uniqueness is the Lord Jagannath, he is sharing his place with his siblings. Like in the middle is Subhadra and right to her is Balram. At this point, I would like to thank and congratulate all the organizing team and a special thank to Dr. Bhagya, who has given this opportunity to inspire and motivate you all in this platform. Life is an endless journey between perception and reality, right? Till we take a last breath, we will always be planning in our own profession. But our profession is endless. And it's we who are going to decide like when to stop and when to discontinue. Let me brief you the significance of conservative dentistry and endodontics as a master degree. During this process, it's my sincere apology if I'm going to hurt anybody. So kindly excuse for that. Thank you, Dr. Chanchala, for giving the brief introduction about me. But at this juncture, I would like to explain myself and my experience as a doctor, then as a dental surgeon, as an endodontist, then as a wife and mother. So I finished my schooling in Bangalore, that is Christ College, then PUC again in Christ College. Then I joined BDS and in BITS, then Masters in Oxford Dental College, then got married, and then the entire base was shifted to Bhubaneswar. I didn't know like what is going to happen in future. So since I got married, as a lady in our culture, it's there. Wherever your husband goes, you need to follow them, right? So the same way for me also it was. Then I joined as a senior lecturer in the Institute of Dental Sciences, Bhubaneswar. That was a budding college. So just a UG lecturer, UG guide I was. Then over a period of time, it became a PG institution. So I continued with the PG guide. And the entire process, the past 16 years, the journey was amazing and more challenging it was. So I developed keen interest. I have a passion of doing a clinical practice. It's my passion. Whereas at the same time, academically, I want to excel. I love teaching, okay? So that made me to get into the publications, research. Then after that, I became EC members for various associations. then I got fellowship in research, clinical research, then diplomate. So these are the things which I tried to attain over a period of time. So each and every phase there was a challenge to me. So I had to overcome these challenges. So what it made me to overcome, I'll just explain to you in my further slides. The most important is the patent. So when it so happened that I was into microscope, micro endodontics. Now it's a boom in a clinical dentistry. Everybody wants to do micro endodontics, right? So when I started with the microscope, I didn't go for any huge or any got training or did fellowship in microscope, but I did for myself. I had a microscope. I tried. I did a lot of procedure on an extracted tooth, learned the technique, and learned to manage like which are the instruments I can use so that I can attain that expertise. So in that process, there were many instruments which I discovered, and I wanted to patent those things. So that patenting journey was too horrible because it was a new thing for even for the university, even for me. So somehow I went into that field and applied the patents, 4 patents to my name, and 1 patent is the first kind of patent was granted to our institution, which is on my name. So what after BDS? We have a lot of confusion and anxiety, right? So many of them will follow practice. Many of them want to prepare for their MDS. So most of the students, when they come to me and they ask, ma'am, what to do after BDS? What to do after our internship? So I ask them, so what is your passion? Whether you want to practice or whether you want to pursue your MDS. So most of them, they say that they are going to practice. But whatever the scenario now we are facing, so the next question, what I'm going to ask, are you confident in practicing? Because the knowledge, whatever now they have attained, because of this, let it be the pandemic situation, many of them have not exposed to the patient. Doing on a simulated or on in a typhodont is totally different when it comes to patient. Okay, we are dealing with a patient. So what the answer for that is, they will pay the money, they will learn the procedures and become expertise in the clinical conditions. So I say, why you have to pay money? Your own faculties are there, utilize them. So they are the source. They will help you out how to learn things, how to learn the procedure. So that's the suggestion what I give to them. The next set of people, they want to prepare for their exams, NEET exams. So they ask, ma'am, whether I have to join coaching or whether I'll do the self-study. So when we are in practice, once we finish our undergraduate, what we expect? We will be earning a lot of money. So we can pay, if we have taken the loan, probably we will be able to pay it, right? But the reality is what? You will have a lot of expectations from your relatives, let it be society, let it be, as well as from your peers, right? They will have a lot of expectations. So now let me explain to you, like what if you do, once you join the coaching, what are the cons and pros and cons, and what are the disadvantage of doing self-study. So always students will be in anxiety and confusion state, right? So the coaching, the advantages of having or joining the coaching center are, you will have the competition among your peers, right? Then sometimes you will be confused You will be bored, okay, as it becomes monotonous. And sometimes so happens you have to face again the faculties of different speciality. You need to again learn things. It becomes very monotonous, right? So what is the key? So somebody should be there to push you constantly so that you can attain success. Now, who can push? It can be your parents, it can be your friends, it can be your seniors. So that constant push should be there always. Now, something I have mentioned or there, 5 square. This 5 square is very important. I implement this and I follow it. Now, first 5 is you need to plan your life for next 5 years. So always, now you have finished your BDS, now you are in internship. So you need to plan yourself for the next 5 years, what you have to do, where you are going to stand, how you are going to work for it. Okay. So some people now during your internship, so you might be planning for to open up a clinical practice, right? So for that, you need to have a financial support. So how you are going to do it? The next is if you're planning for doing MDS, my suggestion will be do the MDS first, finish your master's, and then start with your clinical practice. And financially, you can be strong after your MDS also. Okay. So always after 5 years, again, you need to go ahead and plan for next 5 years, what you have to do. Okay. So 5 years plan is very, very important. That's how I do. It's out of my experience, I do the same. So every 5 years, I plan accordingly where I have to stand, what are the goals. So the next 5 comes is your tips on staying motivated. That is the 5 steps. Set your goal, reward yourself. You need to recognize yourself, okay? To stay motivated, you need to reward yourself, okay? Then you need to create and be positive and stay organized. So that's how you have to, this 5 square is very, very important in our life. Now, self-study. What are the disadvantages of having self-study? You will get confused. You will get distracted with many of your social medias. So you get distracted. Then you have a lot of thoughts which will be running in your mind because you are alone, okay? And you tend to sleep. When you take a book, you get bored of, oh God, what is it happening? So you tend to sleep, okay? So for this, what is the solution? The solution is you need to have a partner with you who is very loyal to you and you can discuss anything to you. I think Dr. Bhagya will understand better. So success doesn't come from what you do occasionally, but what you do consistently. Revision is very, very important. You need to revise a lot. So revision is not going back, okay, or fussing around, but it takes you front into a process of creation. Now, in the same thing, when it applies to endodontics, there is a procedure called as recapitulation. Now, recapitulation and revision, it's the same for us. In recapitulation, what we do is we go back to a smaller size file and remove all the debris so that we can go to the next step. The same thing here also. So revision and recapitulation is the most important for us. So what are the best options? So how you can succeed in your competitive exams. So let it be a group study or let it be a coaching center or let it be your self-study. So find a partner. Revision is most important. Practice and perseverance. That's very important. Discuss and clear all the doubts. So 2 are better than 1. So still, if you don't study or if you're not gain knowledge and do the best, so you won't be able to succeed in your life. So you need to keep motivated yourself. So Preparation is the key. It means that the motivation is the key. So you are born to win, but to be a winner, you must plan to win, prepare to win, and expect to win. Now, once you finished with your preparation and you have excelled the examination and you have joined the MDS course, let it be your any branch, let it be. So just I'll share my experience. After, even I also went through this entire journey and then got MDS in endodontics. I was so happy that I got in conservative dentistry and endodontics. Once I joined, in first initial few months, I felt for this I struggled so much. I had sleepless night and spent so much of time. So that's what I felt initially. But over a period of time, there is a lot of things. There are a lot of knowledge which we have to gain, as well as clinical expertise, which we are not able to get when during our undergraduate level. This can be attained only when we are doing masters, especially the conservative dentistry and endodontics. So what you are going to gain if you join conservative dentistry and endodontics, you will increase your clinical proficiency. By the end of your degree, you will be like a hero in your practice. So from ordinary practice to extraordinary experience you will get. Picture abhi baki hai mere dost, show must go on. This is actually during pandemic, we never stopped working, you know. There were a lot of patients used to come to our dental institution with a lot of severe pain. So of course we have to do our endodontic procedure to them. So what are being a conservative? We have two sections, right? Conservative dentistry and endodontics. Now most of them, if we ask a person which particular subject or the section you like most of the PG students, they say that endo. Madam, we like endo, not the conservative. But conservative is a huge topic, which is uncovered, which is not explored in the way it has to be. Most of them, they have passion to endo, but not for the aesthetic or conservative dentistry. But when you ask me, I love doing conservative because I'll be very much satisfied, and it gives that satisfaction and instant result and the happiness in the face of the patient. It makes it makes very too satisfying to me. So this is a case. So this is how we have transformed it, and the patient was so happy. The smile of the patient, it made me so happy. Then again, this is a bad mutilated teeth where we transformed the entire tooth. Actually, it's a retreatment case. There was a lot of, they had done periapical surgery, then they had done episectomy for this case, and this case it was a challenging case to me, but successfully I have finished endodontic treatment and I've given the crowns, and the patient is happy. If you see that face, the smile and that eyes, that's very satisfying, right? Of course, restorations, this is bread and butter to us. When you start with a clinical practice, you will come across a lot of restorations. Last one. Now, earlier we had amalgam. Now the entire field is composite. So composite, it's not so easy, right? As we think. Composite is very technique sensitive. The students need to understand how to do a composite restoration. It's very important. Amalgam is totally different, but when it comes to composite, it's a totally different material. You can't compare these two. Like how you do a restoration amalgam within fraction of like probably 15 to 20 minutes in an expert hand. But composite is not like that. Composite takes a lot of time. And the indication of composite, again, matters a lot. You can't do in few certain conditions. Of course, the endodontics, the pulp. Many a times we need to remove a vital pulp, but nowadays the technologies are improving. As the previous speaker suggested, that direct pulp caping is in the process. So we have a lot of direct pulp caping techniques as well as materials available, but still in some situation we might have to remove the vital pulp. These are the few obturated canals from simple to complicated. Now, there is a question. Many of them, ma'am, BDS people also do a good root canal. So what is the difference? Why do we have to spend 3 years for endodontics? No, my dear friend, the knowledge what you are going to gain for 3 years is not only the endodontics, it is the restorative dentistry also. So both restorative dentistry and endodontics makes a complete specialty. So because after doing why I'm talking about the restoration is the root canal involves a lot of material, biomaterials or bioactive materials. So those things we are restoring the entire tooth, right? So let's go hand in hand. So along with this clinical expertise, we will be very much pro into the presentations. We will be more confident in presenting in a great forum, in international national forum. Along with that, we will be able to prepare the manuscript and publish most of your articles and most of your research. You are going to do your thesis. So thesis is, again, you need to, nowadays, there is a rule that all thesis has to be published in various scopus and international, national journals, index journals, and in high impact factor journals. So it makes it gives a path or it gives a venue to venture into the clinical research. So not only in your clinical research, it helps to cultivate or it helps to manage how to manage the your behavior. So how to behave with your peers, how to behave with your patients, and how to develop the manner not only to your friends circle as well as for your patient. Then you will learn to fight yourself. That is survival for fittest, right? So the next is the self-realization and self-worth. So you know how to tackle the situation once you finish with your MDS. In your future, if you think there is any kind of difficult situation comes to you, you will know how to tackle that. So as you have realized and you are trained for that, okay? Now, what is life after MDS? You have academics. Now, academics is like from when you join an institution, from first year to final year, you will be having conservative dentistry and endodontics. So you can join as a lecturer and then you can pursue in that field. The next is private practice. So in private practice, since 80% of our private practice is of your conservative dentistry and endodontics, right? Many of them will accept and agree on that. As our earlier speakers, they have spoken about the special cases and all those things. Even they also agree that when they open up a clinic, to your patient, the day-to-day walk-in patient is of conservative dentistry and endodontics. Then comes your clinical research. Clinical research is a vast field. You can do your clinical research immediately after your BDS, but as Sir suggested that after MDS, you will have a good knowledge or a better knowledge. So clinical research is a vast and you can pursue a good career on that. Of course, you have few government services who are lucky. They are going to get government services. Then hospital practice. You have a lot of corporate sectors who where you can practice your day-to-day practice you can do. Now in your brochure, I saw this: choices, chances, and changes, the 3 C's of life. You must make a choice to take a chance or your life will never change. So you need to take a chance or you need to risk your life, and change is inevitable. So change, you need to accept and flow according to the situation and the condition what you are facing in your life. So we have 9 branches, 9 options, so 9 confusions. So what to take, which branch to take, right? So my personal opinion is every choice is important and that decide the course of life. So choose wisely. And for me, always cons and endo is the best. And I'm really proud to be a conservative dentist and endodontist. So if you give a chance to do, again, I'll do my double degree in the same field because it gives a lot of pleasure in working and passion. There are a lot of things which you can learn in this particular specialty. So we are the one, it's bread and butter in our clinical practice. You can earn, you can explore things, you can be an all-rounder, you can do a restorative, you can create a beautiful aesthetic smile, and then you can be a consultant. So consult at one point, each and every dentist, let it be of different specialty, they need an endodontist. Without us, it's very difficult to survive. So we have body branches. So these, we go hand in hand, okay? That's endoprosto, endoperio, endoortho. So other branches are okay, but these 3 are our buddies. So we go and we share a good bond with them. So if you can do great things, do small things in a great way. You don't have to be great to start, but you have to start to be great. So with this, I would like to thank once again the organizing team for giving this opportunity and the participants who are spending so much of time. I think you people are hungry. So my mantra, success mantra is, I can do it. Nothing is impossible in this world. We can achieve what we want. Only thing is the mindset should be right. I can do it. With this, thank you and best wishes for your future endeavors. Thanks a lot.
Dr. Shashireka, thank you very much for speaking for this webinar. We are grateful for the time and effort you took to share your thoughts and experiences. Your presentation has motivated our budding dentists to be an expert conservative dentist and an endodontist, and also has made them all aware how one can develop soft skills while doing MDS. On behalf of organizing committee, please accept our sincere appreciation in the form of e-certificate.
Thank you. Thank you very much, Dr. Bhatia. Thanks a lot. Good night to all of you.
It was indeed very precise pathway to our participants to achieve their goals, I feel, at this forum. Thank you, Dr. Shashireka. Have a
Thank you
good
very
night.
much. Thank you. Thank you very much.